Welcome. Welcome and to the Pharmaceutical Rule training. I know some of you have been involved in some of these that we've given through the Rule Advisory Committee and the public hearing so far, but this is a little deeper dive, and it's a training for healthcare facilities, and it's as the rule stands here in Oregon. It's not going to speak to Washington dangerous waste or other states waste. This is for healthcare facility generators in Oregon. So we'll go over the Pharmaceutical Rule and those management standards, and we'll talk about how that's been adopted in Oregon, and we'll talk about the P075 listing amendment and how we adopted that as well. I'm going to go ahead and turn my camera off and get started. There's a lot to cover here, and it will probably take up the full 2 hours. Let's just dive in and get started. I always like to start the training off with just a little some informal points and just some disclaimers. So the Pharmaceutical Rule is another set of independent management standards that generators that are also healthcare facilities and have hazardous waste pharmaceuticals need to comply with. That doesn't take them away from complying with what we call traditional hazardous waste rules, or some call it, we use the term RCRA. That's one abbreviation I may ask for grace on and that you let me use. It stands for the Resource Conservation and Recovery Act. And we usually say RCRA or classical RCRA for the regular hazardous waste rules, 40 CFR 260 through 270. So there's those rules that almost all generators need to comply with, and there's other independent and alternate management standards and universal waste rules, used oil rules. There's also exempt solvent contaminated wipes. So all facilities are really under more than one set of management standards, but the basic one is what we call classical or traditional haz waste or classical RCRA. So I found that this rule, a lot of people say it's really complicated and nuanced, and it is, but it's like a big, it's a puzzle with a lot of different pieces, but so it's hard to get started. But once you start fashioning all those great number of small pieces together, the picture comes out not as complicated as you would think. There's just a lot of new definitions and moving parts. So the whole first part of this training is sort of going over that. The management standards in and of themselves for healthcare facilities is not that complicated. And even though it's meant to be more stringent, the federal rule, it really provides some more flexible management standards for hazardous waste pharmaceuticals in order to encourage and promote the best and ultimate better disposal at a hazardous waste permitted facility. So anyway, a presumption we're making here is that the audience has some previous knowledge of the traditional hazardous waste regulations. We're going to be using terms like hazardous waste determination. We're going to use terms like listed hazardous waste, maybe a P acute listed hazardous waste or a U listed waste. We're going to talk about characteristic waste, maybe the characteristic of ignitability, knowing your overall generator size after you have done all your haz waste determinations, and that you're always cognizant and you count your hazardous waste every calendar month, every physical calendar month. It can't be averaged. And you're always cognizant of how much you accumulate on site at any time as well. So you know if you're a small quantity or large quantity generator or a very small quantity generator. And also those that are small and large generators need to have DEQ ID numbers. and they notify DEQ that they're a fully regulated generator, and they have to do an annual report to DEQ for their hazardous waste under the traditional haz waste regulations. So hopefully you all have some background in this, because we're going to talk about how this works in concert with these new management standards for specifically the pharmaceutical haz waste at healthcare facilities. This is not a training on reverse distributors, although I'm sure we'll have one of those in the near future. And we do have a new fact sheet out for healthcare facilities, but not one yet for reverse distributors. So I wanted to ask again, maybe if I mess up, I'll try not to use abbreviations and or acronyms, but if I say RCRA, classical RCRA, I just mean the Resource Conservation and Recovery Act, that piece of legislation that these haz waste rules came from. And again, the 40 CFR 260 through 270. Also, if I slip and say VSQG, I'll apologize up front, but maybe we could roll with that. It's a very small quantity generator. So I'll try to do better. There are some terms, though, I'm going to try to be real disciplined with. So the rule uses the term pharmaceutical haz waste. And then in turn, they say haz waste pharmaceuticals and different types. So I'm going to use the term and try to be consistent and say haz waste pharmaceuticals. Then there's non-pharmaceutical haz waste written in the rule. And I'm just going to call those other hazardous waste, your maintenance waste, process waste, anything that's not a pharmaceutical hazardous waste. If you're a hospital, you're going to have a certain type of pharmaceutical haz waste, medication or prescription maybe, but you might also have a lab, pathology lab that uses solvents to clean equipment, xylene, methanol, isopropyl alcohol, ethanol. Those would be your other hazardous waste, along with some maintenance waste and anything you have in the maintenance area. So we're going to talk about haz waste pharmaceuticals, other hazardous waste, and then there's non-hazardous waste pharmaceuticals. And I'm going to try to say just pharmaceuticals that aren't hazardous. So again, a lot of definitions, it can be confusing. So I'm trying to put them into plain language for us here. And again, we're going to talk about how you balance both sets of management standards a bit. Because as I say, most of your facilities, you already are under several sets of management standards, not just classical haz waste or RCRA. If I make a lot of noise shuffling my notes here or moving around in my chair, I apologize. As a healthcare facility, as we look into these management standards, there's no size distinction. So I'll try to bring that up again. You still have to always know if you're small or large or very small quantity generator for all your haz waste. But once you've determined and know that you're small or large and you're a healthcare facility and you have haz waste pharmaceuticals, you are in and subject to these management standards in 40 CFR 266 subpart P. There's no size distinction though. Whether you're a very small quantity generator that decides they want to opt in, and they do have the option to do that, or a large quantity generator, as you notify as a healthcare facility, it's the same set of rules, no matter what size you are or how much haz waste pharmaceuticals you have. So we'll talk about this and counting your waste throughout the training, because again, this can be some of the most confusing part. So I'll just start with the P075 listing amendment. There's not a lot to cover with that. This is a very specific listing amendment regarding 3 FDA or Food and Drug Administration approved over-the-counter nicotine replacement therapies. These EPA decided they didn't really meet the criteria for a P-listed acute hazardous waste, which was initially meant for a commercial chemical product and nicotine in its purest form. So as you'll see, as we talk about this more, it's very specific to 3 FDA-approved over-the-counter nicotine replacement therapies. Anything out of those is still going to be a P075 listed waste. Unless, as we talk about how things can go out under a farm code, those things that would remain P075 that wouldn't be able to be just discarded under this listing amendment may be able to go out as non-creditable hazardous waste pharma to a hazardous waste permitted facility. So we'll talk about that more in the next slide. And we're also going to cover the Pharmaceutical Rule. And again, just for healthcare facilities today, we're not going to talk much about reverse distributors other than a little bit in how they relate to you as a healthcare facility. But that'll be a training and a new fact sheet to come specific to reverse distributors. The P075 listing amendment is not sector specific, but it is waste specific. But this pharmaceutical rule is waste and sector specific, meaning you need to meet the definition of a healthcare facility, which does include pharmacies, and we'll talk about that more. And it's for your hazardous waste pharmaceuticals. So you have to have both to take advantage of these management standards or be subject to them, both in the sector and have the specific waste. The big thing about the rule, it prohibits putting these pharmaceutical hazardous waste down the drain. And even though we'll talk about how very small quantity generators aren't automatically subject to these management standards unless they opt in, they've all along, even before DEQ adopted this rule, they've been subject to the sewering prohibition as well. But all in all, the pharmaceutical rule, as complicated as it is with all these definitions and moving parts, is really more flexible management standards to promote and encourage good ultimate disposal. And it also takes care of some duplicative regs regarding some Drug Enforcement Agency controlled substances. So we'll talk about all of this. But to continue with a P075 listing amendment, this is exactly what the listing amendment looks like in the rules. If you look up P075 nicotine and salts, that's all it used to say. And now it just has this parenthetical phrase, does not include over-the-counter FDA-approved patches, gum, and lozenges. So this is the big change, and in Oregon, we've adopted that by reference. So these are low-level, low-risk, slowly released nicotine that, again, don't meet the criteria of commercial chemical product pure nicotine. So these can be discarded in with your garbage and your solid waste now. You no longer have to count negligible, invisible residues in empty packages of nicotine patches. I wanted to say one other thing before we advance from this slide. Well, let's stop here for a moment and see if there's any questions on the P075 nicotine replacement therapies or any of the introductory prefaces I did. I sure miss meeting with everyone in person and seeing their faces and answering questions in that manner. So everybody's cool with the P075 listing amendment. I did want to mention one other thing. So anything else that is nicotine, I said, is still a P075 listed waste. E-liquids, oral inhalers of nicotine or nasal spray of nicotine. But again, if you're a healthcare facility, you'll be able to send this out under a farm code on a manifest to a hazardous waste facility, and you won't have to count it. It's not going to make you a large quantity generator any longer. So those are some exceptions. This amendment's only for these 3 specific items.
Hey Bart, this is Ronnie. I would raise my hand, but I don't know where the hand thing is. So when you
Yeah,
say,
Ron.
when it comes to liquid nicotine products that are over the counter, that would not apply. Those have to go out as hazardous waste, correct?
Anything other than this gum, lozenges, and patches that are FDA approved over the counter would still have to be managed. If you're a smaller, large quantity generator healthcare facility, they can go out as farms under manifest, but not as a P-listed waste.
So I would send it out as farms, but do I have to track the residue and all that other stuff? Or does it just go out as farms hazardous waste?
The residue in something that's not these gum, lozenges, and patches, that we'll get to that at the end of the presentation for the empty container residual part of the rule.
Okay. And would I need to segregate it from the other hazardous waste?
No, all this can go in to the same container with all your non-creditable hazardous waste pharma, as long as it's compatible and you're not mixing in things that would violate the dilution prohibition in the land disposal requirements, like arsenic trioxide and some other things. Metals would have to go in separate containers.
Right.
But other than that, you can commingle these.
Okay, thank you.
Yep.
I just want to mention before Bart continues that if you hit the Alt key and the Y key on your keyboard, that'll raise your hand. And if you hit it again, it'll lower it. And also, if you see that toolbar across the bottom of your screen, one of the things you can hit is reactions, and that's where the raise hand feature is. There's a couple ways to get in there. Apologies for not mentioning that up top. All right, please go ahead, Bart.
Thanks, Ellie. Okay, I'm going to move on from the P075 listing amendment then. Remember though, gum patches and lozenges, those are the ones that's no longer included in this. So the federal government says it's not at P075 hazardous waste any longer. So the pharmaceutical rule is the next thing we adopted, and we've adopted it pretty much 99% by reference, with one more stringent clause, and we also tailored it to fit some of Oregon's existing rules. But again, this is sector and waste specific, so you have to be both before you're subject to this rule. And again, today we're talking about healthcare facilities, but that's who the pharmaceutical rule covers: healthcare facilities and reverse distributors. A reverse let me see if I can abbreviate this definition. It's any person that receives and accumulates prescription pharmaceuticals that are potentially creditable hazardous waste pharmaceuticals for the purpose of facilitating or verifying manufacturer credit. So we'll talk about those more, but this is where your potentially creditable hazardous waste would go to receive a manufacturer credit. And we'll talk about that type of hazardous waste and what your responsibilities are. But we're not going to say much more about reverse distributors this morning. I'm a little nervous about this part. I'll just tell you guys, I've been training for a long time, but this rule is so challenging to explain, to understand or explain and convey. So I want to go over this most complicated part, I think, and try to be careful and go slow. So you're a healthcare facility, and we'll talk about that definition and bring up some examples. And you have pharmaceutical waste. We'll talk about those different types that are also a hazardous waste. They're either listed or characteristic. And we're going to repeat some of this. But I want you to know who's automatically into this rule and has no choice but to notify DEQ that they're subject to and following the 40 CFR 266 subpart P standards. So if you're a small or large quantity generator for all your hazardous waste combined, Ronnie was talking about, do you need to track some of the P075 stuff that can go out as farm waste now? Well, to determine if you're in or out, you have to count it at first. And you have to count it along with all your other haz waste. And then if you're a large or small quantity generator, you need to notify DEQ and you're subject to these requirements for the pharmaceutical haz waste portion of your waste stream. So if you take it one step at a time and don't get confused about, do I count it now, count it then, just take it one step at a time to see if you're in. So all your haz waste, again, that means to see if you're in, you need to count your pharmaceutical haz waste as well. And there's that word, non-pharmaceutical haz waste. I said I wouldn't use that. So you count your haz waste pharmaceuticals and all your other haz waste to determine your overall generator size initially to see if you're in. And if you're a small or large quantity generator, counting your combined waste streams, then you're subject to this rule and you need to notify DEQ. So who's subject to the rule and are you automatically in because of your total haz waste as well as your sector? And hopefully this little flow chart will help. And we put a version of this in our fact sheet. So if we start up at the top in green, let's say you're pretty sure you're a healthcare facility or you meet the definition we haven't gone over yet. And you have pharmaceutical waste, that's definitely probably a listed or characteristic waste when you do your initial determinations. So you start here, is it a waste? If it's not a waste yet, well, it's not regulated. And I shouldn't say that, it still may be regulated by or OSHA or fire marshal. But the next step is it a hazardous waste? And that's making those determinations that everybody has to make in classical RCRA or the haz waste rules. If it's not a haz waste, then it can be managed as solid waste. So there's your P075 listing amendment for gum, patches, and lozenges. They're not a haz waste. But other nicotine things still are, so you move on. Is it a pharmaceutical? Does it meet the definition of a pharmaceutical? If it doesn't, you go to the right there and you just manage it as a general hazardous waste under 262, the generator requirements. If it is a pharmaceutical, you keep going down the row here. And are you a healthcare facility? Is that who generated it? If not, again, a pharmaceutical manufacturer is not a healthcare facility. They would go to the right and they would have to manage that as regular hazardous waste under classical haz waste rules. But if you are a healthcare facility, then you go, am I a small or large quantity generator for all my haz waste? And if you are, then you're subject to subpart P, the pharmaceutical rule, for your pharmaceutical haz waste stream. If we back up a minute and we say no there and move to the right, you're a very small quantity generator for your combined haz waste. A small pharmacy, say. You have the choice as a very small quantity generator or VSQG to manage it under the VSQG specific rule in 262, which is 40 CFR 262.14. Or you can opt in to the pharmaceutical rule. If you do, you need to follow all the management standards, just like SQG or LQG for your pharmaceuticals. And you no longer can use the optional provisions we'll talk about later. A very small quantity generator that just wants to stay and manage their haz waste under regular haz waste rules can do that. And they can take advantage of a few of the optional provisions we'll talk about in the rule. But once a very small quantity generator opts in, remember there's no size distinction with healthcare facilities. They're just a full-blown healthcare facility that has to follow all the management standards. And they can no longer follow the optional provisions. So before I move on from this slide, are there any questions? Clear as mud, huh? Ellie, Svetlana, are you seeing any hands go up?
Nope.
Nope.
Getting a thumbs up though.
Have I put everyone to sleep with my Texas accent already?
You're doing great, Bart. Hey, Bart, this is Carrie with OHSU.
Yeah, Carrie.
All right, I'm gonna ask a question. So let's say we have under current rule, under classical RCRA, we have multiple clinics that are small or large quantity generators due to their administration of epinephrine and arsenic trioxide. With the pharmaceutical rule, they would become very small quantity generators because they only generate pharmaceuticals because they are in larger hospitals such as Legacy. Can we close their RCRA site ID numbers and opt into the rule, or do we need to keep the RCRA site ID number and just say they're very small quantity?
I got to think about the way you asked that, because you have to be careful. Initially, are those facilities VSQGs, or are they small or large quantity generators for all their hazardous waste?
For all their hazardous, the only hazardous waste they generate is pharmaceutical waste because they are in larger lease spaces that already have RCRA ID numbers.
Is that pharmaceutical waste though? Are the amounts large quantity generator amounts? Are they
Correct.
currently?
They're all, yes, they're currently large or small quantity generator amounts.
Okay, so we're going to talk about this more, but this is a great question, but we're going to go over it several different times. Let's just take one of those facilities, okay, Carrie?
Okay.
One of them I report to DEQ because I have a P-listed waste and I'm a large quantity generator. So if you follow this flow chart, that facility would need to report and follow subpart P, correct?
Okay, correct.
That's the first step. But what you're seeing now is once they notify us as a healthcare facility, and again, they can't use the optional provisions of a VSQG anymore. They're just a full-blown healthcare facility now. They can stop counting their pharmaceutical hazardous waste. And that means that, and we'll talk about this more, they don't have to report it any longer in their annual reports. So if everything holds true and all their waste is pharmaceutical hazardous waste that made them a large quantity generator, as long as you notify, and again, don't do this. I want to say this here. We've seen some people be a little confused about last year's reporting that was due March 1st. This rule wasn't in effect in 2021, and that's what your March 1st report should have included, was a previous year. So everybody that reported March 1st, you can't be banking on anything with the pharmaceutical rule for your hazardous waste report. But March 2023, for your facility, Carrie, you won't have to report those waste if you notified us, and you're not opting in because that facility was a large quantity generator. It wasn't a very small quantity generator. So you cannot have to submit an annual report any longer, and you can change your generator status now that you're complying with subpart P as a full-blown healthcare facility and notified us. On your active site identification form, you'll put down that you're a healthcare facility. And you'll no longer have to count or report the hazardous waste pharmaceuticals from that facility. If you were a very small quantity generator and didn't have large quantity amounts at that facility, and it truly was a VSQG, or if you wanted to opt in or out, a VSQG that withdraws has to start adding everything back under classical RCRA again. So that sounds like those facilities are in.
Yeah, that makes complete sense. Thank you, Bart.
I'm glad it did to you, because as I was saying it, I deal with this all the time and I know it's confusing. Any other clarifications on that? And we'll talk about it more as we go through, but this is the most confusing part of the rule. It's just remember, once you notify us and start complying and you say you're a healthcare facility because you have small or large quantity amounts of total haz waste, then you can stop counting this stuff. As long as you're manifesting it off as farms waste to a haz waste facility, you can stop counting it and your generator status may go down. But you can't say then that I'm a VSQG, because once you say now I'm a VSQG, I don't even have to notify DEQ as a healthcare facility. You need to start adding your combined waste all over again and reporting it. Okay, thank you guys for your patience. I'm going to keep moving. That was a great question. Hopefully we'll go over it some more. How are we doing on time, Ellie?
Oh, we're doing great, Bart. We've got 10:08.
Okay, we start at 9:30. I may check in to see how we're doing at 10:30 if we need a break or if I need a break.
Okay, good deal.
So let's look at, again, this is waste specific and sector specific. So let's look at the waste part. And I'm not going to read the definition of pharmaceutical. I am going to bore you with the definition of healthcare facility in a moment, but these are just some examples of pharmaceuticals: dietary supplements, prescription and over-the-counter drugs, homeopathic drugs, investigational new drugs, residues of pharmaceuticals in non-empty containers. Ronnie brought up something with that we'll talk about empty container residuals in a few slides. Personal protective equipment contaminated with pharmaceutical haz waste, and cleanup material from the spills of pharmaceuticals. Not included in the pharmaceutical definition of rule is dental amalgam, sharps, and medical or infectious waste. These are not pharmaceuticals. Let me ask you guys a question. How about solvents in labs? Are they considered a pharmaceutical?
I would say no.
Yeah, if you have, like I said before, if you have a solvents in a laboratory, like I see in pathology labs, different types of solvent to clean equipment, it's covered under traditional haz waste rules. It's not a pharmaceutical. Isopropyl alcohol that cleans, if you look at EPA's frequently asked questions, isopropyl alcohol that's used to clean equipment is not part of the pharmaceutical rule. Isopropyl alcohol that's used to clean body surfaces can be put in with your non-credible haz waste pharmaceuticals. Now, I've got a lot of disclaimers as I talk about this slide, so let me throw those out before you start looking over everything. I'm going to say pharmaceutical haz waste here, and I've taken this off some other states' good fact sheets and information, but I'm going to put a couple of big question marks here. These are constituents that are on the P and U list. It doesn't mean they're haz waste. When you do your determinations, you have to look over the overarching definition of P or U listed waste, which is unused commercial chemical product, off-spec species, container residuals, and spill residues. So some of your pharmaceuticals like this are going to end up as a waste or in a container that may or may not be empty. And these listings may apply, but don't just look at the constituent and say, oh, I've got that, it's a haz waste. It might not even be a waste, or it might be able to go out as a potentially credible to reverse distributor. So these are just some examples of things that very well could be, if they meet the overarching definition of a P listed or U listed waste, a hazardous waste pharmaceutical. One thing I want to bring up is, again, the nicotine's been changed. It doesn't just say nicotine and salts anymore. It also excludes those 3 over-the-counter nicotine replacement therapies. Another thing I wanted to bring up were epinephrine base. Epinephrine salts are not a P042. So they're not included, but the base is. It's not soluble, it's more toxic. Nitroglycerin, the P081 that you see I just underlined here, in the medicinal form, it's listed in the P list for reactivity. In the medicinal form, it's not reactive. So your medicinal nitroglycerin is not a P-listed hazardous waste. And I think P046 has some of the same exceptions. So this is just some examples of some of your pharmaceuticals that could be your P or U listed waste. We see blood thinner, the warfarin at a lot of facilities. Interesting enough, with some of the conditional exemptions in the rule for drug enforcement controlled substances, there's only 5 DEA controlled substances that are also a hazardous waste. And chloral hydrate, here on the left-hand column near the bottom, is one. That's a DEA controlled substance, as well as a RCRA or a pharmaceutical has waste. The others, fentanyl, sublingual spray, I'm losing my train of thought here for a minute. Phenobarbital, testosterone gels, injectable Valium are all also has waste, but they exhibit the characteristic for ignitability. So remember, when you make your waste determinations, it's not just listed waste you're looking at, although I just brought some of these examples up. You also have to determine if perhaps they exhibit a characteristic like ignitability. So we'll take that out, and probably if that was epinephrine in the salt form, we would take it out as well of these lists. So we went over some of the waste that could be a pharmaceutical has waste. And I'd like to mention, I forgot to mention this, the rule, EPA wanted to encourage also that folks manage their non-hazardous waste pharmaceuticals. Remember, the thing that I was going to talk about as being a pharmaceutical that's not a has waste, along with your has waste pharmaceuticals. And they could go out in the non-creditable has waste container as well. They put an incentive in the rule in case you would like to do that. I don't know how much more it will cost you, but if you want to manage your pharmaceuticals that aren't hazardous along with your has waste pharmaceuticals, you won't have to keep your documentation for your has waste determinations. That's the incentive they provided in the rule in order to encourage more pharmaceutical waste to go out to a permitted facility. Let me read the definition of the sector-specific here, healthcare facilities. And I encourage you, when you read this rule, and hopefully if you're subject to this rule, you will read it, and you'll read it many times and study it. And I would encourage you to do that before you look at our fact sheet or before you look at EPA's frequently asked questions. I mean, nothing beats just going over the applicability section and the definitions. So a healthcare facility, bear with me here, I'm just going to read this off the page. Any person lawfully authorized to provide preventative, diagnostic, therapeutic, rehabilitative, maintenance or palliative care, and counseling, service, assessment, or procedure with respect to the physical or mental condition or functional status of a human or animal, or that affects the structure or function of the human or animal body. And it doesn't stop there. It's also anyone lawfully authorized to distribute, sell, or dispense pharmaceuticals, including over-the-counter pharmaceuticals, dietary supplements, homeopathic drugs, or prescription pharmaceuticals. So hopefully, if you're a healthcare facility, you know you are. And here are some examples. Wholesale distributors, military medical logistics facilities, hospitals, general and psychiatric health clinics, physicians' offices, chiropractors, optical and dental providers, pharmacies, long-term healthcare facilities. One thing about those is there's some that are in and some that aren't in this definition. So if there's skilled nursing or nursing care or hospice, then that is a long-term healthcare facility. Some other continued care places like independent or assisted living or group homes are not considered long-term care facilities unless there's a nursing care or continued care portion of those facilities. And that portion of the long-term care facility would be subject and could be under the Pharma Rule. Veterinary clinics are also included in the Pharma Rule. But again, when they start out and add up all their haz waste at these smaller clinics or veterinary clinics, do they have enough total haz waste to make them a larger or small quantity generator? If they're very small quantity generator, then they have the choice of following classical RCRA or opting in to the 266 subpart P standards. Things that are not healthcare facilities are pharmaceutical manufacturers and reverse distributors. But reverse distributors are part of the Pharmaceutical Rule. So it's not a healthcare facility, but it's part of the rule, where pharma manufacturers are not. So what's interesting is you guys that deal with pharmaceuticals are subject to the sewering prohibition. Pharmaceutical manufacturers are not, even though they're subject to other Clean Water Act prohibitions for these things, but they're not included in the Pharmaceutical Rule sewering prohibition. I'm sorry, is it 10:30 yet?
It's 10:20, but I did want to mention that Carrie asked a really good question about what is the definition of a dietary supplement. This is a fair question. So I dropped some information in the chat, but I did want to mention that EPA is leaning on FDA's definition of a dietary supplement. So dietary supplements in the Pharma Rule means the same thing as a dietary supplement as defined by the Federal Food, Drug, and Cosmetic Act. So that's FD&C Act. And I'm going to drop a link into the chat now from the FDA that has more information about what is a dietary supplement. So I just thought that was a really excellent question.
Thank you, Ellie. And
Yeah.
thanks, Kelly. Well, let's keep going and let's take a break at 10:30. Is everybody okay with that? Maybe we could take a 5-minute break, if that's long enough.
Getting a thumbs up, Bart.
All right. So we've covered the waste as best we can in this amount of time. And we've covered the sector and who's in and who's out. And we're still trying to understand the whole part about small and large quantity generators and total waste stream counting. And we'll continue to grapple with that. And hopefully by the end of the training, we'll all understand it better. Some of the other new definitions I wanted to go over, though, to make this even more complicated, is among your haz waste pharmaceuticals, there are different types. And in the rule for healthcare facilities and reverse distributors, there's non-creditable haz waste pharmaceuticals, potentially creditable, and evaluated. A healthcare facility up top here alone deals with non-creditable and potentially creditable. Reverse distributors will deal with potentially credible and evaluated. They're the ones that make the evaluation. Does it get a do we give the generator a manufacturing credit, or is it worthy of one? Or do we say we're not the facility to do it and we'll move it on to another reverse distributor? So they make the evaluation within 30 days of it getting there. And then they have 180 days to hold on to it after that, even if they make the evaluation that I call a lower E evaluation, lowercase e, where they're passing it on and they're saying they're not the ones to give the credit. But if they are, or if the second one receives it and says, yes, we're the ones, I can't think of the word, to administer, to redeem the manufacturer credit, then it becomes a different waste stream. It becomes a capital E evaluated waste at the reverse distributor. And then they have 180 days before it moves on to a treatment, storage, and disposal facility. So we'll look at the flow of these wastes here in a second, but for this training, we're going to concentrate on healthcare facilities, which will have non-creditable hazardous waste pharmaceuticals, as well as potentially creditable. And again, these are all waste, and they've all had a determination done, and they're all determined to be hazardous waste pharmaceuticals. And here's a little better definition you'll see in the rules. Sorry for using so many words and putting up such a long definition, but let's look at potentially creditable in the middle first. This is a prescription with a reasonable expectation of receiving that manufacturer credit from a reverse distributor. And it has to be in its original manufacturing packaging. It has to be undispensed, and it has to be unexpired or no more than a year expired. So when we look at the management standards, you're going to see there's not a lot of container management and accumulation time standards for the potentially creditable, because you have to stick to that definition. You have to make sure it's no more than a year expired, it's in its original packaging, it's undispensed. The next one over to the left is non-creditable, which will probably be the majority of your waste stream. These are prescription or non-prescription, over-the-counter stuff with no expectation of a credit. And something that can't be used, reused, or reclaimed. And again, these are waste that are broken or leaking. They're not in their original packaging. They're repackaged. They've been dispensed already. They're past 1 year expired. Includes investigational new drugs, contaminated personal protective equipment, floor sweepings, and cleanup material. And then the capital E evaluation that we'll cover when we have a reverse distributor training means that they've evaluated and decided, yes, we will provide the credit, and there's no further evaluation or verification that's necessary for a credit. And that's the one at a reverse distributor when it becomes more heavily regulated, like a large quantity generator. So let's take a break, and when we come back, is 5 minutes long enough? Did you say we got a thumbs up, or do you think we have time for 7?
We could do 7 minutes.
Okay. Yeah, I know this is a lot to listen to, so let's take a 7-minute break, and then we'll come back and continue if that's okay.
Yeah, so let's come back at around 10:34, 10:35, somewhere around there.
Sounds good.
Okay, see everybody back here just before 10:35. All right.
I muted it that time. I'd like to talk about something as everyone, to reiterate as everyone's making their way back, and then Ellie, maybe you can bring up that comment in the chat after I finish with this statement. So again, remember, under the normal hazardous waste regulations, you're always counting all your hazardous waste. Pharmaceutical hazardous waste, non-pharmaceutical, all other hazardous waste, your general hazardous waste. So to determine if you're in this rule, as we went over in that chart, you need to count everything that's hazardous. And then if you're over very small quantity generator amounts, meaning you have enough to make you a smaller large quantity generator of your combined hazardous waste streams, and you're a healthcare facility, and you have hazardous waste pharmaceuticals, you're subject to, you don't have a choice, you're subject to these pharmaceutical rule standards. And you need to notify DEQ on our site identification form as a healthcare facility. And then when you do that and you start complying with all the subpart P pharmaceutical rule standards, then and only then can you stop counting the pharmaceutical hazardous waste portion of your waste stream. As you're properly doing the container management on site, you've done your determinations and you're manifesting it off to a hazardous waste permitted facility with the exempt farm codes where the waste codes usually go. So a lot of people say, well, if I do that and stop counting it, then I'll fall to a VSQG and I'll just won't be subject to it anymore. No, if you do that, then you have to start counting everything again. The only way you're viewed as a very small quantity generator in this rule is if you're under the VSQG amounts for all your hazardous waste. Anyway, Ellie, did you want to bring up that one comment you got in Teams? I'm not on Teams at the moment, or in the chat.
Yeah, so someone dropped in the chat that EPA has clarified that potentially creditable, outdated, over-the-counter drugs that are also hazardous waste pharmaceuticals can still be sent through reverse distribution, since healthcare does not use reverse logistics, which is interesting. And I had not heard that. And the person who dropped in the chat said, I believe it's in the EPA FAQs. Okay, I can go take a look for that and see if I can find it.
I'd like to comment on that just to clarify some things.
Yeah, absolutely.
So I remember reading something to that effect, but the way that's put is, so reverse logistics, are different than reverse distribution. Reverse logistics is for things that are not yet a solid waste, so you don't have to do a determination on it. And the facility is going to use, reuse, or reclaim it. So it doesn't enter into the hazardous waste part or the pharmaceutical part. And but I think what that statement talks about is there's not a lot of that goes on with over-the-counter pharmaceuticals. Reverse logistics, I think that's what they mean. And so I see where they're coming from here. I'm not an expert on that. I'd have to look at it and get back to anyone at this point, but I know if it's prescription pharmaceutical, it can't be more than a year expired if it's going to a reverse distributor. So anyway, thanks for sharing that. I'm going to have to bone up and look into it again, but I trust you. Are we ready to get moving? Is everybody back? Ellie or Svetlana, are you guys ready to go?
All righty, let's do it.
And the recording's on?
Yes, it is.
So we looked at these different types of hazardous waste pharmaceuticals. And again, we won't be talking about evaluated anymore or reverse distributors. This is just for healthcare facilities. And now that you've done your determinations, you've counted all your waste up, and you know your small or large generator, and you're in, and you report and notified us as a healthcare facility. this is how your waste will flow to the proper facilities. So the non-creditable hazardous waste pharmaceuticals will go to a treatment, storage, and disposal facility, a permitted hazardous waste facility, under a manifest with the code. Farms code will show in a minute in the box where the waste codes go. And we'll talk about how long you can accumulate them and all the other container management and training requirements around that. There's more requirements for the non-creditable hazardous waste pharmaceuticals than there is for the potentially creditable that will go through a reverse distributor. But ultimately, whether it goes through 1, 2, or 3 reverse distributors, everything's going to end up manifested to a treatment, storage, and disposal facility. So this is good management, the best management for all these waste. And remember, they can't be put down the drain or sewered. So now that you know you're in and you're grappling with how to use our Your DEQ online system, and you know you need to go and look into submitting a notification to us on the site identification form, because you're a large enough generator and a healthcare facility with your hazardous waste pharmaceuticals, you need to notify DEQ that you're a healthcare facility using our site identification form within 60 days of being subject to the rule. So we know a lot of people are overdue now since the rule came into effect January 1, but we know people are still grappling with YDO or Your DEQ online, as well as learning this rule. So you have to be in compliance, but we understand, and we're trying to provide trainings like this in the fact sheet. And there's a little bit of if you do get an inspection now, and I don't know how much time is left, but there's a little grace period where DEQ inspectors still have to cite violations, but they won't, violations that have to do with this rule won't be, what's the word? Assessed for a civil penalty. But Ellie, is that time period is 3 months or 4 or 6? I forget.
It's actually been pushed out a bit to the end of the summer.
Okay.
So through August. It's just to give folks time to come into compliance. This is a complicated rule. There's a lot of moving parts, like Bart said. So we, in good faith, assume that our generators are trying to come into compliance. And so we're just allowing that grace period for that to happen.
Right. And as EPA and our enforcement section will tell you, and I want to make sure that I say this correctly, this doesn't say it's okay that you're out of compliance. And the violation will still be cited, because ideally, in a perfect world, you need to be in compliance with everything, as you know. But there's some planning going on with priorities as far as inspections. There's the fact that it won't be actually assessed for a civil penalty until that time. But the big thing is a positive note, even though there's just a couple of us, lean on your technical assistance people. I've already been helping people, giving them little 2-hour refresher trainings. I'm going out to sites. Call myself or Alex in the Portland office, or Brian, at least for now, in the Central Eastern region, and take advantage of our, hopefully you got our fact sheet too, and call us if you have questions. I want to talk about this box to the right. If you are withdrawing and you're saying, look, I'm a very small quantity generator, I want to withdraw from the rule, you need to notify DEQ using the site identification form, and you must submit the withdrawal before you start operating under the very small quantity generator requirements in 262.14. And you need to keep a copy of that withdrawal for 3 years from the date of the signature on the withdrawal notification. But again, beware, once you withdraw, thinking you're a VSQG, you have to start adding everything back together again and counting your pharmaceutical has waste. So make sure you're really going to be a very small quantity generator before you withdraw. Excuse me. And this is what you'll see. I mean, it will be one screen will go to the next, but for this presentation, we had to stack them. When you go to notify us, you'll see in section 14 on the site identification form, you know, you've seen the universal waste and the used oil handler stuff. Now you'll get down to the additional regulated activities. In pharmaceutical activities, you'll click yes. And then under healthcare facility, you'll click yes. And I want to mention, if Mary Fritzman's in the audience, I'll have her chime in, but again, if you had a report due March 1st, you weren't a healthcare facility with the pharma rule for last year. So anything you reported on March 1st, you need to have your P listed waste on there. You need to have the fact that you're a large quantity generator, because that was all under traditional has waste or classical RCRA. Now your next report, March 2023, for the reporting year of 22, you can stop counting those waste and stop reporting them to us. So what we're telling people, and Mary, chime in, please. I told one facility, we're reporting as a small quantity generator for 2021 in this report we just submitted in March of this year. But now, as Carrie was talking about, and Ronnie, we're going to be generating less waste. So our overall generator status and how we handle all our other has waste, we're going to go down in size. And one facility I talked to is going to be a very small quantity generator. And so we're telling people, why don't you wait and get a feel for it? Notify us as the priority. Remember, you can start shipping these waste out in a manifest with a farm's code and no longer counting them. And next year you won't have to report them. And then maybe after you receive your invoice in June or July for last year, then you can talk to Mary or myself about re-verifying and changing your generator status on your form, as long as you've notified as a healthcare facility and you're in compliance with subpart P. Mary, before I talk about withdrawing, do you want to add anything to that if you're still in the house?
Yeah, I'm still here, Bart. Thank you. I just want to remind generators that for the 2021 report, your annual site ID report form, you need to report the generator status you were for 2021. So if you drop down now in 2022 with the pharma rule that just went into effect in January, you may need to send in another site ID form with your new generator status and also the pharmaceutical checking yes and clicking the pharmaceutical or the healthcare facility button also. So you probably do need to send in another form if your generator status changed from your annual report generator status for 2021. So thank you.
Thanks, Mary. Any questions on that? Hopefully everybody got their report in just fine, March 1st or close, and you realized you were still a large quantity generator and the pharma rule went into effect. So this is how you notify us. If you want to withdraw, then you go into this section, and we had to click different boxes to get this printout here, but you would check no more pharmaceutical activities. I'm withdrawing. I'm just going to operate as a very small quantity generator. And then you would click yes, withdrawing. And look at these warnings here. I like this. And we got this, I believe, from the federal biennial reporting. If withdrawing from pharmaceutical activities, no must be selected for pharmaceutical activities. And then the second box down, statement down there in red, in order for a healthcare facility to withdraw from subpart P, generator status must not equal large quantity or small quantity generator. So there's another warning there. Be for sure if you're withdrawing and you're going to operate under the very small quantity generator requirements under classical RCRA for your hazardous waste pharmaceuticals. So let's just do a quick overview of some of the management standards. Hopefully this is not as confusing, this part. So I've broken it down here between non-creditable hazardous waste farms and potentially creditable. So everyone has to notify. I mean, nobody's going to have just one type anyway. If they do, it would be more non-creditable than potentially creditable. So you have to notify as a healthcare facility, and also reverse distributors have to notify. You need to label your hazardous waste pharmaceuticals as hazardous waste pharmaceuticals for non-creditable. There's no label on the potentially creditable pharma, but remember they're in their original packaging. There are container standards. You know, it needs to be in structurally sound containers compatible with contents, lacks evidence of leakage or spill. There's no container standards for the potentially creditable, again, in their original packaging, undispensed. So just always look to the definition for that. This is like your universal waste. You can accumulate your non-creditable hazardous waste pharma now, not for 90 days, not for 180 or 270, but you can accumulate them for a year, up to a year. There's no biennial reporting or like Oregon annual reporting for your non-creditable hazardous waste pharma or your potentially creditable. So you no longer have to report these to DEQ. But you'll still have the manifest information if needed on site, and we get information from the TSDFs on manifesting. So you don't have to report, but you do have to notify, and VSQGs can opt in and become a full-blown healthcare facility, but they have to notify, and if they do, they can no longer use the optional provisions. There's a statement in there about employee training for those folks that handle non-creditable hazardous waste pharma, but I assume at your facilities, the same staff will handle both. And I assume you would want to really train them around both. But in the rule, it's silent for training around potentially creditable. And again, we'll see in a minute, the training requirements are pretty basic, like a small quantity generator, not prescriptive like a large quantity generator. You'll no longer have to do weekly inspections of your non-creditable hazardous waste pharma containers. And there's no such thing as a satellite container now to save you time on the time clock because it's moot. You're not under a time clock other than the 1 year accumulation limit. And you will manifest your non-creditable hazardous waste pharma off with these waste codes. The longer waste code is for a paper form. For e-manifest, it would be just PHRM. If you do a hybrid, your transporter may want you to start, and I think EPA said that they favor just the PHRM now because it might end up in an electronic form, even though it starts out at your facility on paper. And then we'll talk about shipping potentially creditable to a reverse distributor. They're not subject to manifesting requirements. They can even go through some regular post carriers like FedEx or UPS, as long as somebody's at the reverse distributor to accept it and confirm its arrival right away. So we'll look at those and break them down here for a minute. So container standards, yes, for non-creditable. There's not any for potentially creditable, and you need to label the non-creditable hazardous waste pharmaceuticals. And again, for the potentially creditable, remember the definition: original packaging, undispensed, no more than a year expired. Accumulation limit, there's not one for potentially creditable, but remember they can be no more than a year expired. So there's some sideboards around that just in the definition. Accumulation limit for the non-creditable, again, is 1 year or less. And you need to be able to prove that by either labeling each container with a date, using an inventory system, or have a designated area showing when the earliest drum arrived in that area. And you can use any of these or a combination of them. So, like I say, more flexible accumulation limits, more flexible ways in approving that you're meeting that accumulation limit, all to drive this good disposal of manifesting all this waste to a hazardous waste permitted facility. Potentially creditable, again, I think you would want to train both, but it's silent in the rule about it. But for non-creditable, folks that manage and handle this hazardous waste, they need to be trained. And it's not real prescriptive, but you need to ensure that all personnel managing non-creditable hazardous waste pharma are thoroughly familiar with proper waste handling according to this subpart P pharmaceutical rule and your own emergency procedures relevant to their responsibilities during normal operation hours and emergencies. So your manifest now will no longer have a waste code on it for your hazardous waste pharmaceuticals if they're going out as non-creditable on a manifest. You'll put these abbreviations on there instead. And the containers don't have to have the waste codes on the containers either, unless there's something like arsenic trioxide or something, again, that you have to keep separate and, you know, would be prohibited with a dilution prohibition in the land disposal requirements. Any question on the labeling, container standards, manifesting, or employee training before we move on? Okay, I'll keep going. Jump in if you want. Shipping, again, the regulations vary a bit regarding shipping. And so prior to shipping your non-creditable, your transporter and your vendor will help you. You will have to follow some Department of Transportation rules that are also mentioned and codified in this pharmaceutical rule. So you can look those up, and there will be some changing of labeling to the words hazardous waste prior to shipment and some other things that you'll need to do. But the main thing is you will be subject to manifesting this waste as a non-creditable. And you need to receive that return manifest to ensure that it made it to the hazardous waste permitted facility it was supposed to make it to. For the potentially creditable, it's a little different, and again, more flexible. They're in their original packaging. They kind of look like a product. They're kind of like a product, but they're not. They're waste. It's not reverse logistics. They're waste, and you have to make a determination. So the main thing is that's actually interesting that it's codified in the rule. It says since these, it comes out and says they're not subject to manifesting requirements. So since they're not subject to manifesting requirements, it says they're not considered a haz waste in the DOT definition. So there's still a haz waste under RCRA 266 subpart P, but since they don't require a manifest, they're not going to be considered a DOT haz waste, but they could be a DOT hazardous material in their own right. So they don't have to be manifest. And again, they could go out even through UPS or FedEx, but if they do that, somebody needs to be there at the reverse distributor to receive it. And you need to get a confirmation of delivery pretty much right away when your potentially creditable shows up at the reverse distributor. If you don't get it within 35 days, they talk about in the rule how you need to approach and do some research and get to the bottom of why you haven't received a delivery confirmation. So for non-creditable, get that return manifest back and use the manifest. Whatever Department of Transportation or mailing paperwork and things you use for your potentially creditable, make sure you get that delivery confirmation and keep it on file at your facility. So here's some record keeping requirements for potentially creditable. You need to notify DEQ and keep a copy of that notification. If you withdraw and say you're going to just go back to being a very small quantity generator for all your haz waste, then you need to keep a copy of that on file and readily available for an inspector to see. There's some delivery confirmations that we just talked about from the reverse distributor. And I'm jumping the gun a little bit on this next box for shipping papers. We're going to talk about in a minute how some facilities can ship some of their haz waste pharmaceuticals to another healthcare facility or a large quantity generator. And if you do that, you'll keep some of these tracking of shipments received, and we'll talk about that in a minute. But keep your DOT shipping papers. And if you receive haz waste from another healthcare facility you're related to and under the same control of, keep that shipping documentation of what you've received. Same for non-creditable waste. You need to notify us and keep your withdrawal. If you do withdraw from the rule, keep copies in your manifest. And for non-creditable haz waste pharmaceutical, you need to keep the documentation of your haz waste determinations on file and readily available for an inspector. Some of these you can keep for 3 years, but with your determinations, you need to keep those indefinitely as long as you have that waste on site. But remember that incentive. If you want to include your pharmaceutical waste that's non-hazardous in with your non-creditable haz waste pharma, you do not have to document and keep this determination documentation. That's the incentive they have for you. And again, if you receive haz waste pharmaceuticals from a related healthcare facility that you're associated with under the same control that we'll talk about here next, you need to track those shipments and keep that paperwork and have it readily available for an inspector to see, showing that I receive haz waste pharmaceuticals from another facility of ours as well. So let's talk about these optional provisions which get at some of those shipping tracking papers, and then I'll open it up to questions again. So if you remember, I said that as a very small quantity generator, you may opt in. Well, if you opt in and you become a regular healthcare facility, what I call a full-blown healthcare facility, you no longer can follow these provisions. But as a very small quantity generator, they did write in some optional provisions for VSQGs that don't opt in. So they really are trying to be flexible and give the very small quantity generators the best of both worlds here. And there's a lot of flexibility built in. So if you're a very small quantity generator for both your hazardous waste pharma and your other hazardous waste, you can send potentially creditable pharma to reverse distributor, just as if you were a notified full-blown healthcare facility. You can still send your potentially creditable to reverse distributor. You can also send hazardous waste pharma to another healthcare facility that you are related to under the same control in a business relationship with or in the same business. Or you can send your haz waste pharma to a large quantity generator under the generator improvement rule. Again, if it's under the same control and following some other criteria. And here they are. In the rule, if you look up 266-502 little l, that's for non-creditable haz waste pharma, that you accept that from an associated VSQG that's under the same control as your business, you need to be operating at the healthcare facility that receives it, notified us and be a healthcare facility, and notify us of your activity. And when it gets there, you need to treat it as hazardous waste pharma, and you need to keep and track the shipments that you receive from that other very small quantity generator associated with your business. So that's 502I. There's 4 criteria. 503B is in case you want to accept potentially creditable hazardous waste pharma from a related VSQG. You need to be a full-blown healthcare facility and you've notified us of your activity. It needs to be under the same control, again, as the VSQG you receive it from. You need to be operating as a healthcare facility, and you need to treat the waste they send you as a hazardous waste pharmaceutical of your own at your healthcare facility. If you want to just send it from your VSQG to a large quantity generator, then it can just follow. Make sure you're following the very small quantity generator requirements in 262.14, and make sure the related facility you're sending it to is a large quantity generator, and they're tracking and complying with the consolidation of VSQG waste under 262.17F at the large quantity generator. So again, a lot of flexibility, best of both worlds for a very small quantity generator with some of these optional provisions. There's also some optional provisions for long-term healthcare facilities that are very small quantity generators. One I want to talk about first and then get rid of is the bottom bullet. The federal rule says if you're a long-term care facility and you have 20 beds or less, then EPA is going to presume that you're a very small quantity generator. We didn't like that because we think it's always a moving target. People need to be making their determinations, constantly inventorying their waste, knowing how much they generate every month and how much they accumulate on site at any time. So we did not adopt this portion of the federal rule. That's the one place where we're more stringent. But another one that we did adopt was you can, at a long-term care facility that's a very small quantity generator that is not opted in, they can dispose of some of their hazardous waste pharmaceutical, with exceptions of spill cleanup debris and personal protective equipment, in an on-site receptacle that's registered and authorized by the Drug Enforcement Administration agency. I mean, if you're authorized collector. And this waste can actually go, if this is for organ generators, it can go to a municipal combustor. And this is where, along with, they've actually have some conditional exemptions for DEA, Drug Enforcement Agency take-back programs. This is where they got rid of some duplication in the rules. If it's around the drug enforcement authorized collector and receptacle and it follows the DEA rules, then they're going to be, in this rule, you get exempted from the traditional RIC or hazardous waste rules. So as long as it's secure and safe and doesn't fall into nefarious hands and it goes to a municipal combustor and it's destroyed, or by some other means that the DEA in writing will say is considered destroyed and can't be retrieved, then all these VSQGs have to do for this waste is follow the DEA standards. So again, a lot of flexibility built in if you're a smaller facility. Any questions on those? How are we doing for time?
Looks like we've got about 20 minutes remaining.
Ooh, we're almost there. So save the best for last. This can be confusing, and a few disclaimers here. this table that I kind of mocked up from bag barring and stealing from EPA and other states is oversimplified. So just know that. I think it's still sound, but it's very simplified, and then the fact sheet the same way. So I'll explain some of that. But I don't know if a lot of you guys remember, we had to have some guidance from EPA, and the states provided some guidance for some of these things, because I used to work with like the VA hospital, that their dispensing machine would break down and they would be grappling with triple rinsing small dispensing bottles that held pills, because there was no way around triple rinsing an acute hazardous waste container to prove that it's what we call RCRA empty. And again, the Resource Conservation and Recovery Act. So this is really good. They codified and they made some changes here, and they actually codified it in 261.72 of the general empty container standards. They mention this and refer back to it. So I'm going to go over this really fast. Please jump in with questions. And again, for some of it, like syringes, I've oversimplified it a bit. So I refer you to read the rule. So now, and again, as far as I want you to all know that if you have a container and you've emptied things out of it, even though there's still some residue left, that container and that residue may be exempt and no longer hazardous and can be just thrown in the garbage. Or now it may have to be included in your non-creditable hazardous waste pharmaceutical container. So stock dispensing bottles at the top left-hand side and unit dose containers, you need to remove the contents, whether it's a non-acute characteristic waste or whether it's a P-listed or acute hazardous waste. Just remove the contents for these containers and you're done. They're RCRA empty. If you have syringes, the practical means to empty a syringe is fully depress the plunger and administer it. Or if you can fully depress it, I guess, and put it in with a non-creditable hazardous waste pharma, but the container, the emptied syringe, can be RCRA empty and no longer hazardous and can be just discarded. IV bags, it gets a little trickier. IV bags is not something you just cut open and try to drain. So again, it says if you fully administer the contents, but it's still not empty, if there's some remaining residue, then you need to look into 40 CFR 261.7 B1. And again, you can look that up, but it just means just like a drum of waste at a site, you need to empty it by all practical means. And then there needs to be less than an inch left in the container after you've made an effort to empty it, or 3% of a container, 119 gallons or less, or 0.3% left in it of a container, 119 gallons or more. We have a little state discrepancy there where we tailored this one. Our cutoff for 3% or 0.3% is 110 gallons. But nevertheless, if the IV bag can't be fully administered, then you need to see if it meets the empty container standards in 261.7. Try to empty it the best you can. If less than 3% is left in it, then it's good enough and you can discard it. That's for non-acute hazardous waste pharmas in the middle section. On the right-hand column under IV bags, you fully administer the contents. But if it's not empty, then you need to put it in with your non-creditable hazardous waste pharmaceuticals. So you don't have to triple rinse it, and you don't have to cut it off and get it all out. You can just put it in with your hazardous waste pharmaceuticals. All other containers, just like Plasco RCRA, they need to meet 40 CFR 261.7. Empty it by all normally employed means. If there's a certain amount left, then it could be exempt, even if there's a little residue left. If it's that's for non-acute waste. If it's a P-listed waste, an acute hazardous waste, it just cannot be RCRA empty. There's no triple rinsing. but there's no discarding it in the garbage either. You need to manage it with your non-creditable hazardous waste pharmaceuticals. Questions on this? Okay. So here's a little summary of what we did in Oregon. We adopted the P075 listing amendment by reference across the board, just like it is federally. We adopted the Pharmaceutical Rule by reference, except we did not include the less than 20 bed long-term care facility, very small quantity generator presumption. And it's mentioned that we did not adopt this in our Oregon administrative rules here, noted. These portions of the pharma rule we tailored to the Oregon state rules, and they're listed in OAR 102-500. You need to notify on Oregon site identification form, not to the EPA. Reverse distributors are going to need to report to us annually the waste that they manifest off, that they're not the generator of, the originating facility is, but they're still going to have to report it to us under a different farm code so we can track it. The federal rule states they have to report that waste biennially to EPA, but in Oregon, we made it an annual reporting to us. As far as I know, we have no reverse distributors yet. And as I mentioned, for the empty container residual standards, after you empty it by all practical means, or if the inch or less, or 3% for something 119 gallons left or less, and 0.3% for something over 119 gallons, we use the 110 gallons, smaller cutoff there. So I want to end on a positive note since this is so confusing. So benefits for healthcare facilities. I think this is a great rule, although complicated, and it was needed because I went out to a lot of healthcare facilities and saw what they were grappling with, and classical RCRA just didn't meet their sector needs as much as this rule does. So the benefits for healthcare facilities for the hazardous waste pharmaceutical part of their waste stream is they can accumulate this waste now for up to a year. They have basic training requirements. If they were a large quantity generator before, they had pretty prescriptive training requirements for these facility staff that handle the haz waste. Now it's basic training requirements as a small quantity generator, not that prescriptive. You no longer can be a large quantity generator just for your 1 kilogram of acute haz waste, as you're subject to this rule and exempting this stuff out under a farm code. You're not subject to satellite accumulation for this waste stream because you're not under a time clock other than the 1 year. You don't have to specify each individual waste code on the manifest. You just put in the farm code. You don't have to perform weekly inspections on this waste, non-creditable hazardous waste pharma or potentially creditable. And you don't have to report this part of your hazardous waste stream to DEQ on your annual report any longer. But you're probably going to have other hazardous waste, and you still may be a large or small generator for that waste, and you still may need to do an annual report under classical RCRA for the other portion of your hazardous waste stream. And again, this is just for the hazardous waste pharmaceuticals part. The prohibitions for you as a healthcare facility for your hazardous waste pharma, it can't be sewered or put down the drain. These wastes must end up at a permitted hazardous waste treatment, storage, or disposal facility for final disposal. And you cannot send any non-creditable hazardous waste pharma to a reverse distributor. You can only send potentially creditable to them, and that's all they're supposed to receive. And I appreciate y'all's patience. I know there was a lot of talking on my part and a lot to cover. I hope it was helpful in some regard, and I hope our fact sheet helps you, but be sure and call us and talk to us individually or have us out to help you with some technical assistance around this, or your regular haz waste streams as well. Ellie, if we have time left, I can take questions, or you can close us out.
Yeah, we have time for questions. Anybody have questions for Bart? Someone asked in the chat if DEQ offers consultative visit. So yeah, these technical assistance specialists can come out and do a site visit with you, yes. Okay, well, if you have questions later, definitely feel free to contact us and we would be happy to answer your questions. I'm gonna go ahead and stop the recording here, and then I just have a little bit more information to share before we adjourn.